Are you expecting a baby and searching for safe, gentle, and powerful ways to stay active, reduce discomfort, and prepare your body for childbirth? In this video, we're going to explore the incredible benefits of Swiss ball, or Fitball. Exercises for pregnant women's simple yet life-changing movements that can ease back pain, improve posture, boost flexibility, and even support you during labor. You'll discover how something as effortless as a pelvic roll on the ball can bring relaxation, confidence, and strength to your pregnancy journey. Stay tuned, because what you're about to learn could completely transform the way you experience these 9 months, and leave you feeling more empowered than ever before. But before the video starts, write in the comments, from where you are watching this video, thank you. Pregnancy is often described as one of the most beautiful, transformative, and profound journeys in a woman's life. A unique period that blends physical change with emotional growth and spiritual awareness. Yet alongside the beauty, there are also moments of discomfort, fatigue, and uncertainty. Which is why many mothers-to-be begin searching for safe and effective ways to maintain their health, strength, and peace of mind throughout these precious 9 months. Among the numerous practices available today, Swiss ball Fitball exercises for pregnant women stand out as one of the most versatile, gentle, and supportive methods, because the ball itself encourages natural movement, balance, and flexibility, while also providing a soft and comfortable surface that adapts beautifully to the body's needs during pregnancy. When we speak about a Swiss ball, also known as a Fitball, we are referring to that large, air-filled exercise ball that is often seen in gyms, rehabilitation clinics, and fitness studios. Yet when placed in the hands of a pregnant woman, it transforms into a nurturing tool that not only strengthens muscles, but also helps relieve tension, improve posture, and prepare the body for childbirth. Imagine the image of a mother sitting comfortably on the ball, gently rolling her hips in slow, circular motions, breathing deeply, and feeling her lower back muscles release the accumulated tension of carrying a growing belly. This simple scene demonstrates how powerful and yet how gentle these exercises can be. One of the most recommended movements during pregnancy is the pelvic roll on the ball, a fluid and graceful motion in which the expectant mother sits on the Fitball with feet firmly planted on the floor and slowly rolls her pelvis forward, backward, and in circles, allowing the ball to support her as she loosens her hips and strengthens her core at the same time. While the movement itself is simple, the effects are profound. It encourages better circulation in the pelvic region, reduces lower back pain, enhances mobility, and gives the mother a sense of confidence in the natural rhythm of her body, preparing her both physically and emotionally for the process of labor. To understand why Swiss ball Fitball exercises for pregnant women are so beneficial, we need to look closely at the physiological changes happening during pregnancy. As the baby grows, the mother's center of gravity shifts forward, her ligaments become more elastic due to hormonal changes, and her lower back often bears the brunt of the added weight. This combination of factors frequently leads to postural imbalances, discomfort, and even difficulty sleeping. Traditional exercises, while helpful, sometimes place too much stress on joints or do not provide the level of support needed for a body that is constantly changing. But the Fitball offers exactly that support because it moves with the body instead of against it, cushioning, balancing, and adapting in a way that feels safe and nurturing. Beyond the physical benefits, the Fitball also plays a significant role in the emotional well-being of pregnant women. For many, pregnancy can be overwhelming. The body feels unfamiliar, daily movements require more effort, and there can be a sense of vulnerability that lingers just beneath the joy. Sitting on the ball, however, encourages playfulness and freedom. The gentle bouncing, the rocking, the rolling motions all bring a sense of childlike ease, reminding the expectant mother that movement can be soothing rather than stressful. In this sense, the ball becomes more than an exercise tool. It becomes a companion, a safe surface upon which she can rediscover her strength and resilience, while embracing the changes of pregnancy with greater confidence. A true story illustrates this point beautifully. Imagine a woman in her second trimester, who had once been very active, but was now feeling increasingly limited by the heaviness of her growing belly. She was advised by her physiotherapist to begin using a Fitball at home, starting with simple seated positions. At first, she was hesitant, afraid that her balance might not be steady enough. But within a few days she began to notice that the ball actually improved her stability rather than threatening it. By the end of the week, she found herself looking forward to her sessions, particularly the pelvic roll on the ball, which not only eased the pressure in her lower back, but also gave her a sense of empowerment. as though her body was reclaiming its ability to move with grace despite the changes of pregnancy. The science supports this lived experience. Studies have shown that exercising with a Swiss ball can activate deep stabilizing muscles in the abdomen and pelvis, which are crucial for maintaining good posture and protecting the spine during pregnancy. Additionally, these movements stimulate circulation, which can help reduce swelling in the legs and ankles, a common complaint among pregnant women. The rhythmic nature of exercises like pelvic tilts, hip rolls, and gentle bouncing also mimics the soothing motion of rocking, which not only calms the mother but may also provide a sense of comfort to the baby within the womb. Another powerful benefit of Fitball exercises is their role in preparing for childbirth. Labor requires not only strength but also flexibility, endurance, and the ability to release tension in the pelvic floor. And exercises like the pelvic roll on the ball are ideal for training these qualities in a natural and enjoyable way. By practicing controlled movements, mothers learn to trust their bodies, to feel how their hips can open, and to recognize the rhythm of their breath as an ally in moments of intensity. Many midwives and doulas even recommend the use of a Fitball during labor itself, as sitting and rocking on the ball can help progress contractions, while offering relief from the pressure of lying on a bed. Of course, as with any exercise program during pregnancy, safety is paramount. Women should always consult with their healthcare providers before starting Fitball exercises, and should choose a ball of appropriate size, usually one that allows them to sit with knees bent at a 90-degree angle and feet flat on the floor. It is also important to exercise on a stable surface, free of slippery rugs or clutter, and to move slowly and mindfully, listening to the body's signals at every step. While the ball offers wonderful benefits, it is not about pushing limits but rather about cultivating comfort, mobility, and connection with the body. What makes these exercises truly inspiring is how they transcend the physical and touch upon the emotional journey of pregnancy. Every movement on the ball, whether it is a pelvic roll, a gentle bounce, or a stretch supported by the ball, becomes a meditation on adaptability and resilience. It teaches the expectant mother that her body, though changing daily, is still capable of strength, balance, and grace. It reinforces the truth that pregnancy is not a limitation but a transformation, and that through mindful practices she can embrace this transformation with courage and joy. Consider the atmosphere of a prenatal class where several women gather in a quiet room, each with a brightly colored Fitball. They sit in a circle, laughing softly as they practice rolling their hips, some nervously at first, others with the confidence of experience. The instructor guides them through a sequence of movements, encouraging them to breathe deeply, to imagine their breath traveling into their bellies, nourishing their babies with every inhale. There is a sense of community in the room, a reminder that they are not alone in this journey. And as the class progresses, they begin to share smiles and nods of encouragement, bonding over the shared language of movement and motherhood. This communal aspect is often overlooked but deeply powerful. Swiss ball Fitball exercises for pregnant women are not merely about strengthening muscles or improving posture. They are about creating spaces where women can connect with themselves and with each other, where they can share the joys and challenges of pregnancy in an environment that celebrates their strength and nurtures their well-being. In this sense, the Fitball becomes a symbol of balance, not only physically but emotionally and socially as well. Even after childbirth, the benefits of Fitball exercises continue. Postnatal recovery often requires rebuilding core strength, improving posture after months of carrying a baby, and finding gentle ways to reconnect with the body. Many of the same movements that supported the mother during pregnancy can be adapted for recovery, making the Fitball a long-term ally in women's health. In some cases, the ball even becomes part of playtime with the newborn, as mothers discover that gentle bouncing or rocking on the ball while holding their baby can be soothing for both. Ultimately, the story of Fitball exercises in pregnancy is a story of empowerment. It is about giving women tools that are simple yet effective, playful yet profound, physical yet deeply emotional. It is about reminding them that even in a time of great change, they have within them the capacity for strength, balance, and joy. Every roll of the pelvis, every breath taken in rhythm with the body's movement, is a reminder that they are preparing not only for the birth of their child, but also for a new chapter of themselves as mothers. So when we speak of pelvic roll on the ball, it is not merely an exercise, it is a metaphor for the journey of pregnancy itself. Just as the pelvis rolls forward and backward, finding its rhythm and balance, so too does the expectant mother roll with the changes of her body and her life, discovering new strength in the process. The ball supports her as life expands around her, teaching her that balance is not about standing still but about moving gracefully with change. In conclusion, Swiss ball Fitball exercises for pregnant women represent far more than a set of movements. They are a philosophy of gentle empowerment, an invitation to embrace pregnancy not as a burden but as a dance. A flowing, rolling, breathing dance that honors both mother and child. Through exercises like the pelvic roll on the ball, women discover that they are not only capable of adapting, but of thriving, finding joy in movement and peace in stillness, and entering motherhood with a sense of strength and serenity that will stay with them long after the ball has been set aside.